Hello, friends. Greetings from Malaysia. Welcome to another episode of my transformative learning experience. And this is the series where I had conversation with my Train the Trainer alumni. And I tell you, during these sessions, I have so much of privilege and joy of learning from so-called my course participants or students, but they don't know they are my great teachers. And in this episode, we are going to share their wisdom. And today we have great privilege of meeting Madiha, the CEO and founder of Plus Vibes. And Madiha is also named as Women of the Future and Global 50 Rising Star in ESG. And during my TTT, I could feel Madiha's passion to help friends who are struggling with mental health and general well-being. Madiha, I know how busy you are and such a privilege to have you in the podcast. Thank you very much for making time.
Thank you so much, Dr. Prava. It's actually an honor for me as well to be part of this podcast.
Wonderful, wonderful. We have met at least virtually for now. And perhaps you don't really need introduction when I saw your profile, but for the benefit of our friends from any part of the world, please tell us a little bit more about you and what inspired you to establish Plus Vibes.
Thank you, Dr. Prava. Okay, a little bit about myself. I've been an entrepreneur for the past 10 years, but my first job was actually a business journalist at The Edge. And that's where I got the whole inspiration. You know, at the age of 22 years old, interviewing all these CEOs, it was very intimidating. But that's why I was thinking, okay, I want to be like that. One day, that's my dream, that's my vision. So it's about creating that hope, that vision that I want to be like them one day. So I started small. It was a food truck, doing, freelancing, doing a lot of corporate events. And then we expanded into doing a cafe in Wanutama. And I think with this, although you have that hands-on experience of being an entrepreneur, starting from scratch, knowledge is always key. So I went to go do my MBA and pursue my PhD. And then it's about growing from there. But in 2019, I think my whole life changed. And that's where my outlook in life changed as well. And my career, I got into an accident. I suffered a permanent nerve damage. And that's where that whole year of not being able to move my arm, constantly getting the panic attacks, anxiety attacks really affected me. And that's why I thought, okay, I must not be the only one going through this. There must be some people maybe going through worse, or maybe going through some sort of life-changing event, midlife crisis even, or an accident where they need a support system. So that's where we were thinking, my team and I were like, okay, let's do this. Let's create a mobile app for starters where we can connect all the counselors across Malaysia in one platform. And the key was to be unique in the sense that, when I needed that help, I needed on-demand support. So that was our uniqueness. You need help right now. Within 2 minutes, you can get connected to a counselor, to a psychologist. We've expanded the services from then. It started off as a mobile app with only 5,000 users, and now we have over 50,000 users. And we've conducted, thousands of mental health therapy sessions, consultations. We've provided support. I'm amazed to see, and my team is amazed to see the impact that we've created. So it was from the app to training programs to hosting mental health awareness events to really creating a holistic impact for mental health.
Wow. I like that word, holistic, and having the access almost immediately with the privacy.
Yeah,
within
definitely.
the apps. And with your thousands of sharing session with experts and before our discussion, we were talking about feedback from those who've gone through 50,000, and the numbers are growing, and I hope in going international. Uh, Based on all this data and your own passion, Madiha, um, what is your take on the state of mental health in our own country? Where are we now?
Well, interestingly, when I was doing a lot of research, mental health issues and concerns is not something new. I mean, in 2015, we already know that around 29% of Malaysian adults suffer with mental health disorders. And that's a big part of the society. 29% of Malaysian adults. Now, how many Malaysian adults are there? Around 25, 23 million. So that's like a third of the whole population that are our workforce. So when we look at that, that's in 2015, pre-COVID. And we only got to know about all these suicide rates, divorce rates, and the mental health concerns, the awareness that companies are taking the initiative to do now because COVID helped create that whole limelight. So it's expanding. I think the more awareness that there is, the more people get access to help, the more resources are available. But it's always been an issue. Only now there's more awareness about it.
Wow, 29%.
Yeah.
And looking at the situation post-COVID and all the life challenges and work stress and so on and so forth, the number, how I wish it can come down, but the logic says it's only going to go up.
Correct.
And from your perspective, when we were discussing on this title, from stigma to support, friends who are listening, I'm talking to Madiha, the CEO and founder of Plus Vibes, who have access to experts in various fields, and she reach out to them, or rather the mental health patients or friends who need help can reach out through her apps. And besides the apps, Madiha and her team also provide various awareness and skill set required for us to face these challenges. And I'm so saddened to know almost 30%.
Yeah.
From your perspective, what are the stigma associated with mental health? Especially at workplace. I remember if someone have an accident, we will bring orange and we pity them, we bring some fruits and so on. But when it comes to mental health, what are the stigma? Can you share your thoughts?
This is a very good question because when we talk about stigma, right, we're thinking, okay, why won't people open up? Why won't they just share their problems? A lot of it is because of the perception. You don't want to be seen as incapable, not able to work, as incompetent. All these issues and all these concerns are related to mental health, when actually mental health is holistic. It's about perhaps you're having a bad day, perhaps you're having you got scolded by your managers or bosses. These are temporary daily stress, but of course it affects your mental health. Now, why would people bottle it up? Because imagine if you were to always share your concerns. Imagine if you were to always publicly share, okay, I'm not good enough, I'm struggling with this, I'm going through a personal relationship issue. What will happen? A lot of times people will start judging you, and people will start saying, oh, maybe this person is slacking and not becoming productive because of these issues. There's a lot of assumption there. And it would affect your individual's, status, perception, a reputation in a workplace. And that's where we identified, okay, what if we made it anonymous? What if nobody knew what your concerns were, but you still had the opportunity to share your problems and get the kind of support or different perspective and ideas? Because it's all about support system. So when I do a lot of reading, when I interview a lot of these psychologists, counselors, and mental health individuals with mental health concerns, a lot of it comes down to, I don't have a support system. I have no one to bounce off my ideas. I went through a bad day. I'm going through this. But there's no support where I can just simply ask for help. And I think that's where the whole stigma comes from, the inability to reach out for help.
Wow.
Mm.
Meaning millions of friends, could be our family members,
Mm.
relatives, loved ones, who are struggling, yet they don't have access, or rather, they don't have a system or an environment who understands their pain without judgment
Yeah.
and help them.
I mean, it's just like, if you think about it, Dr. Prabha, when you have a concern or when you have a struggle, you have a support system, someone you can bounce your ideas to, and then how does it make you feel after that, right? When you think about it in that context, you think, wow, it's so easy to prevent people from having mental health disorders or escalating into something more severe and critical simply by preventing it and by providing that kind of support in the beginning when it's something very small.
Exactly. I went through your website, and you know, prevention is better than cure. I just
Yes,
loved it. You know,
yes.
when it comes to our car, we go for preventive maintenance.
Yes, yes. You do the
You know,
servicing,
we go
you change
services.
the oil.
Exactly. And listening to you, the cars get better attention than human being.
Okay,
Just say,
building on that concept, a car, right? Imagine if you were to drive from maybe KL all the way to Penang or all the way to Terengganu. Think about it. Without stopping at the R&R, you wouldn't have enough fuel. The car might overheat. You would become restless in the car. It's about, imagine that's your mind going through things every single day without taking a break. So that's the
wow,
same. So I love that concept of a car because that's exactly how our mind and body works. We're overusing it. We're not resting. We don't have that support system. You know, you don't get your car polished or, having that self-care.
exactly, exactly. And tell us more about consequences of this not conducive environment, or perhaps even toxic environment. And what are
Yeah.
the consequences to productivity at home? And if this kind of culture, if I may call that, continue, what could be the long-term consequences?
So when we're looking about personal consequences, it's about number one, your physical health. That's the first thing that will change. Imagine if you're burnout, if you're always sad, if you don't get enough sleep because you're constantly overthinking. All of this will increase the cortisol level in your body, the stress hormones. Now, what happens when the stress hormone increases? It will affect your heart, it will affect your lungs, it will affect your mind. That's where we see a lot of research showing that you can get cancer, all sorts of diseases, because it chemically changes your body. Stress changes your body. And that's where there's a lot of personal consequences. And you think about, okay, if I'm going through this, it might even be something small, maybe a dispute. I talk about relationship a lot because that's the number one concern on Plus Five's app. It's relationship issues. And it's related to financial issues. When you're financially unstable, it affects your relationship. And that's where we see the increase in divorce rates in Malaysia, and I think in globally as well. And you also see a lot of people not wanting to get married because of that, because of all these personal and societal issues and pressure. So in terms of relationship, you see that if you're stressed, what happens? It will definitely affect your family. It will affect the children, how their upbringing, and then it will become a societal cycle whereby you go through this whole mental health issue, concerns, stress, and it's a loop. So that's why there's a lot of stigma, there's a lot of issues, there's a lot of consequences if it's not catered, if it's not prevented.
Wow. Just listening to you, I'm just visualizing,
Mm,
we hire talent, we
yeah.
go through so much of filtering, interview, and the talent spend thousands of hours with university education and multiple certification. And when their environment increases their cortisol level, and I remember reading the consequences of cortisol level to the entire physical, mental, emotional well-being. And in today's world where creativity, innovation, engagement is required to perform at competitive level, we are sabotaging our own resources by
Yeah.
not creating the right ecosystem or right environment to manage mental health. And so I had the privilege just glance through after learning from you during our train the trainer certification program, where you shared uh, perhaps the glimpse of what mental health is all about, the well-being all about. So can you share the services your organization provide to provide support for someone struggling with mental health?
Of
What are the
course.
list of services, and how is that been going on so far?
Of course. So it starts off with app as a public user. So there's two parts to it: as a public user and as a corporate user. So as a public user, it's a freemium model. So of course there are services that you can use for free. And the reason why is because at the heart of Plus Vibes, it's always about contributing to society. So that's where we feel that, okay, sometimes people cannot afford to pay. Sometimes people are afraid to pay for their first session. So that prevents people from actually reaching out for help, right? So the first is about providing the chat with Vibers, on-demand support. The second is them booking a session, a virtual consultation or a physical consultation with mental health professionals or life coaches. And then the third is browsing all the motivational activities, relaxation activities, because sometimes you don't have a problem, but you want to increase your knowledge in terms of mental health. Or if you want to, listen to a peaceful soundtrack, something that I'm guilty, I love doing. I love winding down at the end of the day and listening to all the relaxing piano, instrumental music, because that small thing can actually change your whole mindset and how you sleep, go to sleep, right? So that's the first part, mobile application for the public users. On the corporate side, it's more of the employee assistance program, EAP, or employee wellness programs. It's the app where from the app, the users can download, the employees can download. We track the usage, but it is anonymous. So the data report that we provide is anonymous. We'll tell you what is the major areas of concern, how many times they chat, what was the feedback after they booked a consultation. So you get a holistic overview of how your organization is doing in terms of mental health. And from that data, we then do the training programs. Now that's where we specifically cater to, okay, this department, marketing department has childcare issues. It's not really an upskilling issue. It's more of a personal issue. So it might be financial, it might be career progression. So that's where we do the training programs. And last but not least, we also do the events. So International Women's Day, International Happiness Day, Smile Day, Men's Mental Health Day, a lot of these kind of things, because it's about culture building. And then we appoint mental health ambassadors within organizations. We train them, we upskill them, we provide first aid mental health training. So there's a lot of things that we do. And it's not just the part where you provide support, right? It's about creating that holistic service where maybe people don't need to talk to a therapist. Maybe they want the cultural engagement. Maybe they want the workshops. So it's really catering, providing different solutions so that people can feel like, okay, this one, I like this one. There's no one solution fits all. So we really try to cater to what the employee wants.
Wow.
Mhm.
I just can keep on listening to. I can feel the passion. I can feel the joy of, and you specifically mentioned uh, people who can't afford it. They have
Yeah.
access to it. No. Tell me some of the success stories. what I understand it's anonymous, but based on data, the feedback from them, um, what are some of the success stories that, because of the work that you and your team is doing, uh, what could have been prevented? Luckily, from the initial intervention, and the hope that you are giving, your team is giving. Hey, there are someone who's not going to judge me, and these are experts, and though that means they are trained to provide hope. Please tell us more about this.
I think it's more about the suicide cases. So for us, sometimes when we see a suicidal individual, we really try to provide that immediate support. And for them, that on demand support is key. Because if you think about it, if they're going through a tough time um, and they want to reach out for help, but they don't know where to reach out for help, they have to book, it's a bit troublesome, right? So that's where we see a lot of suicidal individuals coming on the app looking for support, and all they really, really, really need is just someone to show that they care. And that's where we see that the power of providing comforting words, comforting voice notes, immediately allowing them to share what they're thinking, and then providing that support can definitely change someone's perception on life. So it's just like when you're thinking of, for example, you went through a bad day and your whole thought process is fixated on that one bad point in life, right? But then you forget that you've had some good days. And having someone remind you that there are some good days, this is a learning curve, you should have hope, giving that motivation is really, really priceless. And that's what we see so far. We've supported, I think last year it was 900 suicidal individuals. And I think it's more now. Yeah, and to put that into context, I think in the past 2 years, there were 2,000 individuals who committed suicide. And I mean, luckily, we were able to support and care for 900. And I hope that we have prevented it because they constantly have that support system with us whenever they need help. One example I can share is, and I see this reoccurring a lot of times, because when we do our prevention measures, when we're thinking about what are some of the main criteria and main issues, what are some public awareness programs that we can do, and we look back at what the issues are. Number one, it's mothers, I would say aging above 40s, having concerns, having struggling to support their sons, their daughters, their children who are below 20s. And these children are going through a lot of societal pressure, which results in them being suicidal, right? So then you see both of them are having this miscommunication, really having that pressure, not being able to support one another. The mom doesn't understand the child doesn't want to share with the mother. And that's where we see, like, okay, how about we provide the support to both of them? So when we do, we allow them to understand each other, and that's where you really build back that connection. It's not an immediate fix. I would never say that it's an immediate fix, but it might take around 3 months, 6 months, a year for them to actually have that hope that, okay, maybe we can try to understand one another. So you see, it's all about having that different perspective, providing that support system. So I talk a lot about support system because we really feel that having that support system, different perspective, connecting them, making them understand one another can really mitigate it from escalating.
Support system.
Mm.
I'm just visualizing someone who is going through a very down or low phase of their life, having suicidal kind of intention.
Dr.
If some,
Pradva, that was me. That was
yeah,
me.
boy, when, if they don't even have, if they just go and have, I've read something, even just to take a spoon and eat, it's a
Yeah,
struggle. Just to wake
yeah.
up from the room and go to take a shower, it's a struggle. Brushing their teeth, it's a struggle. If someone who knows that without judging them that they are lazy or, hey, you have no discipline or lecturing them, if after listening to you, I hope our audience know they don't need a lecture. They don't
Yeah.
need motivation. They need genuine support from relevant healthcare professionals.
Yeah.
And imagine if I know someone or audience here knows someone who's struggling. Can you guide them how they can have access to your services? What should be the first few things they do?
Well, you can just download the app or you can scan this QR code. So you can download the app. It's available on the Google Play Store and the Apple Store. It's free for you to download, for you to browse, see what works for you, what doesn't work for you. Other than that, we also include other resources. So there's mental health associations, NGOs, clinics. There's a lot of things on the app. So it's not just about Plus Vibes. It's about creating that community around mental health.
Wow. So as simple as download Plus Vibes and explore that. Friends, looking at the number that Madiha shared, almost 30%. So if you can just take some time to reflect, perhaps each and every one of us will have someone who love, someone we care, someone we know.
Yeah.
And with these apps, they can reach out to somebody who can help. And when I went through your website, Madiha, there was quite a number of articles which talks about the cost of mental health challenges at workplace. It runs in billions. Tell us more for those employers, chief financial officers, CEOs who are responsible for return of investment, responsible for profit and loss, responsible to make your company productive. Tell us, what can employers do to employees or their stakeholders? We're all here. Talent is the most valuable resource. If these talent are struggling with mental health challenges, tell us the implication to the productivity and what can employers do to facilitate that.
Well, definitely the loss in terms of productivity is around 14 billion ringgit. And when we're thinking about that, how does that number come about? So we're looking at the GDP that it costs to the economy, to the Malaysian economy. And I think the statistics was around 2017, if I'm not mistaken. That's pre-COVID. A lot of the data is pre-COVID, and that it's already in the billions that it's costing us. And how? It's because of workers working while unwell, so they're not productive, being absent or sick, taking sick leave because of mental health issues. It's because of the staff turnover. It's about them being there or creating a toxic workplace and causing people to resign. So there's a lot of cost that's going on there simply by loss of productivity. Now, what can employers actually do there? It's about creating that holistic services. Like I mentioned, there's no one solution fits all. It's not about providing the once a quarter mental health events. It's not about the workshops that have no continuity. It's about creating different types of support system so that each employee feels that, okay, maybe this relates to me. Maybe I can try this one. Or it's about educating them, creating that psychologically safe workplace, right? So there's a lot of things that goes into mind when creating a workplace that supports mental health, that really cares about an employee's mental health. So I would say number one, providing a safe space, so an anonymous place or platform where the employees can look for help. Number two, it's about educating, so training programs, but training programs, not really a touch and go kind of program where, you provide one program and expect them to execute and inculcate in their habit, because it takes a while. to change habit, right? And then it's about creating that whole community where everyone feels safe, the psychologically safe workplace where everyone's not afraid to share their opinions, to share their concerns, and seek for help.
The word psychological safety.
Yeah.
I remember very clearly reading about it. Google, when they wanted to enhance teamwork among their employees, Googlers, they actually came out with a project. They call that Socrates Project. And they did a research. What are the factors that influence a good team? And number one was psychological safety.
Yeah.
So if, while I using the word, I must admit, I cannot really visualize what it means. Managers like me, leaders like me need help. So what can, because sometimes it's not, I generally think people are nice and nobody go there to harm somebody. But being ignorant is not an excuse. So how can professionals like you or your team of professionals help managers to support their team? As what I like to use the word ABC, awareness before change. Well, there's a lot of writing about mental health, but do really people understand? So how do you empower leaders, managers with the skill set so that they can help others?
Very good question. So in the training program, what we typically do is a 6 months course. The first one, it's about creating that understanding for the leaders themselves, because the leaders themselves would have mental health issues, concerns, and high stress too. So it's about the understanding of themselves. The second is about how their words and actions can influence their team members. For example, without using the empathetic communication style, right? How when you type an email, when you respond to, or when you review one of your employees or team members' work, the way you say things really plays a big role. And especially in the when we're looking at generational differences, right? Some people might think, okay, I'm saying this in a normal way. What's wrong about it? But how different generations perceive what you say is very different. So it's about understanding different generational gaps, what they see as empathetic, and really understanding that what you say means a lot. So the first is about oneself. The second is about understanding what the generational difference is. And the third is about inculcating it as a habit. Right? So what we do is develop and assign projects for them to work on every month. So that's why it's a 6 months program. Because again, in order to develop a habit, it takes around 21 days. I think I read a book about that, to really build something and really make it a habit that it's within you to act like that, rather than, thinking consciously, it becomes subconscious, right? It has to take 21 days. So it has to take a whole month for you to really practice, to really do the self-reflection, to be assessed on it. So when you keep on doing that, that's where you see like, okay, I understand how myself as a leader, my mental health, I understand the mental health of others and how I'm impacting them. And lastly, I've tried to practice it and I can see the feedback. I can see how it changes and motivates the team. So then we do this 360 approach, 360 feedback. The superior, the leader themselves, and then the team members. Do they feel like this program or this training where, the leaders' well-mind training really helps transform the corporate culture? So it goes through that kind of phase whereby, it's about oneself, others, and then it's about practicing those habits.
Nice. Leaders who are listening, right after this, you have no excuses that you were not aware.
Yeah.
If I'm not really aware that I'm going through some kind of if I'm having fever, I can feel it, or I can use a thermometer to
Correct.
measure, no, even COVID and all that. Yeah, we can just test it, and we know is it double bar or single bar, and we know we need help from the doctors. But when it comes to mental health, for a layman like me, what is your suggestions, or what are some of the initial indicator that I need help and I may need to download the Plus Vibes apps or talk to other healthcare professionals? What is your advice to give me an idea that a person, a leader who's supposed to be responsible to managing themselves first, who need help, and they themselves is not aware of it? So what are some of the indicators?
So the first, if you realize that you have a change in behavior, for example, you used to eat certain things, you used to like hanging out with certain people, you used to like doing certain things, and suddenly you feel, oh, it's okay, I don't want to do it anymore, I have no time for it. The change in behavior is the first indicator, right? Perhaps you like eating a certain food, and now suddenly you're like, no, it's okay, right? So the second is about you distancing yourself from other people. So it's isolation, because you feel that that connection, that social connection is very tiring. You don't want that social support. So you're isolating yourself. That's the first step, where you're removing that support system. And maybe the third, it's about you finding yourself being always demotivated and tired. So when you're tired, it shows you're not motivated to wake up. You're not motivated to go out, execute work, go to the workplace, and you feel like, what's wrong, right? And there must be some times when you feel that. Maybe you might say it's burnout, but that happens because it was a built up. It might be a built up in stress. It might be a built up in personal issues that causes you to act differently. I think the extreme part of it is when, for me at least, it was when you don't really find anything enjoyable. You're thinking, yeah, okay, that's nice. I'm not interested anymore. You start really having that mindset that nothing in life is enjoyable anymore. So I think the key is, if you notice a change in behavior, if you're distancing yourself from your loved ones, if you're always feeling tired, burnout, sleepy, not motivated, then try to talk to someone. Why? Because when you talk to someone, what happens is you're thinking. I mean, the best way I would say is journaling, because you're writing down your thoughts, but this takes practice to really pull out your thoughts and putting on paper. But it's the same concept when you're talking or chatting with a mental health professional, because you're still doing the same thing. You're sharing your thoughts. You're not bottling it up inside. So I think that's the best part about it. When you're reaching out for a mental health professional, it's about taking out what you're thinking, really sharing your opinion, and then getting different perspectives.
Can I say that these initial indicators that
Yeah.
telling, hey, Prabha, you need help,
Yeah.
instead of suppressing it with sleeping pills and so on, or in some cases, go and get alcohol or get some escapism. So you are reminding all of us, if you notice some change in behavior, indicators that you don't enjoy or you are struggling, these are initial indicators for us to start taking action before it become worse, and we'll never know
Yeah.
what
I like
can
to
happen.
share that. Yeah, I like to share that therapists just change the mindset, the stigma, and see that therapists or mental health professionals are basically like your buddies with professional background, and them knowing all these psychological techniques, skills, and knowledge. But see them as a buddy that you can reach out to seek for help.
And the keyword that I'm hearing from you, since they are trained,
Correct.
they won't be judging you. And I mean, you won't go to anybody for your heart surgery, right?
Correct.
Yeah, you won't be talking to. So this is where resources that you have or other mental health professionals, are trained to listen, to diagnose, to help. And that is a skill set where listening from you, clinical psychologists, psychiatrists, counselors, and so on and so forth. But can you help us to understand layman? When I say layman, someone who don't even know the difference between mental health and laziness, for example. So people who
Mm.
are struggling with mental health can be perceived as not motivated. So give them 7 steps to motivation, or send them for a motivation course, or just blame them that you are just disciplined, and so on and so forth. Yeah. So what is your suggestion? Can people who are not trained healthcare professionals, what can they do at least at the initial level to prevent, or at least not to escalate these mental health challenges? What is
I
your
love
suggestion?
Yeah, I love this one. I think it's about creating a caring and contributing to a caring society. Now, the word caring, what does that mean? It's about really knowing if your colleague, friend, loved one is going through a problem. Or maybe caring means, hey, asking someone, are you okay? You know, how are you? How many times do we actually have that kind of conversation? Or maybe number three, it might be asking someone, hey, let's go for lunch, let's go for coffee. Why? Because creating that social connection will make people feel wanted, loved, and part of a community. So I think that's the best part. It's about contributing to a caring society. And last but not least, it's also about your language, how you communicate. And I cannot stress this enough. Um, we see a lot of situations where, because of, like I mentioned earlier, the generational differences, the language and the communication is received differently. So it's about really understanding how the other person will perceive whatever you are saying and whether they'll take it the right way. Sometimes we want to give a feedback. We want to give a constructive feedback, but it might come across as being rude or being mean or being hurtful to another individual. And then that's where demotivation occurs, right? You feel, wait a minute, why is this person suddenly calling me out and saying this, this, and this? You know? So it's how you communicate, what you do to contribute to a caring society, because the small actions that you do can really, really influence someone's perception on life itself.
Wow.
Mm.
I'm processing the power of simple steps.
Yeah.
Checking on somebody, saying hello, a smile, show genuine care, communicate eyes to eyes instead of only looking at the phone, build the connection.
Yeah.
And this seems to be common sense, but unfortunately common sense don't seems to be common. People
Yeah.
seem to be more connected to the Wi-Fi than to the person next door or next to them.
True.
Madiha, it has been 45 minutes and I've been enjoying this conversation. And I'm so happy that professionals like you are exploring the art of sharing this wisdom, creating awareness, and listening to you. I realize the power of technology, how it can reach out to people, how
Yeah.
people who need help can do that with the comfort of not being judged. Yeah. Because if someone is sitting outside a psychiatric clinic, there could be some judgment. Someone who's sitting in front of a clinical psychologist, I hope with your sharing, all of us know these are professionals who are working hard to help, and we should at least don't judge them. Be supportive. And I really like when you reminded the leaders, take care of yourself, managing self. So this is where sometimes I'm guilty at times also. We wear the badge of honor, so being super busy that you don't have time to even realize that you need help.
Yeah.
And one of my friend, Siva, if he's listening, a very wise guy, he said one of the indicator of a successful man or person or a lady is they have a good night's sleep.
Mm.
And I realized there's many people who are dependent on drugs just to sleep. And I remember sometimes jet lag and so on, even not getting sleep for 1 or 2 nights, my whole system seems to be collapsed. And listening to experts like you, I realize sometimes those who are struggling with mental health, they have so much of problem just to have a good night's sleep. So they need help. They need care. They need someone who understand them. The basic things like all our grandmothers and parents says, just show some love and care. And with this simple step, love and care, we can perhaps at least reduce the probability, if not preventing, this significant society issue of mental health. Madiha, as a parting word, what could be some, you have said a lot, but to summarize to all our audience here, what can they do to contribute to those who are struggling, to those who need help, and for those who, if not given help now, could end up struggling? How would you summarize it?
I think the first thing is, number one, what you can do for yourself. Reach out to someone who you find will make you laugh. Maybe it's your parents, maybe it's your siblings, or maybe it's your friends. Reach out to someone who you can just talk to, whether it's a video call or a phone call. Talk rather than chatting, right? Because from there, you really trigger that serotonin, that dopamine, that excitement in you. So that's one thing that you can do. And for corporates, I really, really hope corporates would pay more attention to the employees' mental health. Moving forward, there's going to be a lot more challenges, a lot more societal pressure, a lot more financial constraints for individuals. So providing some sort of mental health support, different types of support, will really, really help the employees. After all, like Dr. Prabha said, the workforce are the backbone of the organization. So care more about them and create a lot of different types of initiatives to support them.
Wonderful. My friends, it has been such a pleasure listening to Madiha, and we can feel her passion, her team's effort. And for those who need help downloading the apps, it's as simple as just download, visit the website, and on behalf of all the listeners, I would like to say a big thanks to Madiha and your entire team. And I wish more people will get help from professionals like you so that we can reduce the pain and struggle of those who are going through the mental health issues and prevent it as much as we can. With that, Madiha, once again, thank you very much for your time. It has been such a pleasure. Thank you very much, my friends.
Thank you.